got a virtual shadowing session. Today we have Dr. Stukus. My name is Michael. I'm going to be today's session host. And just to introduce you to Dr. Stukus, he's a pediatric allergist and immunologist, leading influencer of pediatrics. He serves as associate professor of pediatrics in the Division of Allergy and Immunology and director of the Food Allergy Treatment Center at Nationwide's Children's Hospital. A couple of reminders before we begin. We encourage you to turn on your cameras if you're able to. This session will be recorded also and uploaded to our YouTube channel. Also, there will be a Q&A at the end of the session, and you can unmute at any time or at that time, but feel free to write your questions in the chat at any time, and we'll cover them during the Q&A. So Dr. Stukus, with that said, feel free to take it away.
Oh, thank you so much. I am honored to be here today, and I appreciate the kind invitation to join all of you. Michael, please interrupt me if you can't see me or advance my slides or anything like that. Just say, hey, Dave, you screwed things up.
Yeah, on my side from here.
Yeah, great. It's my pleasure to be here. So I'll spend the first part just kind of telling you a little bit about my journey. I hope you're going to see it's probably a little bit unique and somewhat different from some of the other speakers that you've had. And I'll just basically kind of walk you through my career path and what I do on a regular basis. And I'd love to take any questions either along the way or at the end. So thanks again for joining in. I hope everybody's staying healthy. Who knows this city? Somebody must know this city. I wonder if anybody's in this city. Oh my God, I have some people saying no. That's Pittsburgh, folks. So that's where my story begins. I was born and raised in a suburb of Pittsburgh. And that's where I spent my youth and grew up as a Steelers fan, still am a Steelers fan, Pirates, Penguins, you name it, it's sort of in our blood. And that's where I stayed for my undergraduate and medical school training. And as I was going through my high school training, I thought I wanted to be a civil engineer. And the reason why is because I love math. And it's fun because I see it now in our 11-year-old son. He loves math as well. And I thought in the city of bridges that's what I wanted to do, was build bridges and use math to build things. Well, it turns out I actually kind of got a little bored with math, if that's possible. I'm sure a lot of you are saying, yeah, that's pretty possible. And a lot of my close friends were taking courses in biology. And I started learning more about biology and science, and it really intrigued me. So that is when I enrolled at the University of Pittsburgh as an undergraduate degree in molecular biology, which is basically biochemistry. And it turns out I took 7 classes in psychology during my undergraduate time. And I just have a natural interest in how the human mind works. Flash forward to where I am now. It turns out that this background has gotten me to exactly the point where I am right now as an allergist immunologist, with my love of the immune system and physiology and biochemistry and immunology, and also the work that I do with not only educating patients and patient care, but online through social media as well. So I just somehow naturally lucked into setting myself up for a wonderful combination of these 2 interests of mine. And that's where I went for my undergraduate studies. And I ended up staying at the University of Pittsburgh for my medical school training. And then I went to Nationwide Children's Hospital for residency. I'm sure you're all very well aware of the normal path. You're committed to 4 years at least of undergrad, 4 years of medical school, and then most residency programs are 3 years. But if you specialize after that and you go into surgery or anesthesiology or orthopedic surgery, things like that, then you have even longer after that. So I went to Nationwide Children's Hospital, which was then Columbus Children's Hospital at the time, where I am now, Columbus, Ohio, for my pediatric residency. And I knew going in, the reason I enrolled in medical school was that I knew I wanted to work with kids. It was just something that I was always very interested in. And every step along the way, all of my rotations, I took the approach of, I will probably never do vascular surgery again, but while I'm here, I will immerse myself in it for several weeks. If there's something that really catches my eye, is that enough to pull me away from my love for pediatrics? And every step along the way, none of it did. And then when I finally did my peds rotation, I just knew I was home. So for all of you, my advice would be, find your passion. If you're not sure what you want to do with your life, that's okay too. Expose yourself as much as you can to a variety of things. And then the one thing that you find yourself going to on your own free time, or reading about in your free time, or more importantly, not caring when you're still on the floors taking care of patients at 1 o'clock in the morning, that's probably your passion in your life's work. So sort of follow your gut and your instincts and find what you're passionate about. During my residency, I actually enrolled in residency thinking I wanted to be a cardiologist. I love the plumbing aspect of it. And then I did my cardiology rotation pretty early in my intern year. And I learned very quickly that I don't love cardiology. Specifically, I didn't love reading the telemetry or the heart rhythm strips at 2 o'clock in the morning. So that was my wake up call saying, I'm not passionate about this. But what I fell in love with that fall of my intern year was I started wondering, why are so many children with asthma getting admitted to the hospital? And I learned about all the heterogeneity of asthma and how complex it is. Here's a flash forward. I recently was a guest on the Cribsiders podcast, and I talked about this. I talked about the complexity of asthma, how there's a lot of shared characteristics such as underlying inflammation in the airways and recurrent and reversible episodes of bronchoconstriction. But there's a wide variety of triggers. There's a wide variety of asthma severity. It's a very complex psychosocial phenomenon because there's a lot of caregivers that don't have the skills to take care of their child who has asthma and give them the medication on a consistent basis or recognize the signs and symptoms. And it's a number one leading cause for ER visits and as well as inpatient hospitalization. So I fell in love with asthma for a lot of those reasons. And then thinking through a specialist career, I thought, okay, I can become a pulmonologist. Well, I don't love taking care of children with cystic fibrosis or who are on ventilators and things like that. Or you can go into allergy and immunology. And with allergy and immunology, in addition to understanding asthma, which we're trained to be asthma specialists, we also get to learn about the immune system and take care of patients with primary immune deficiency or peanut allergy or environmental allergies and things like that. So that's when I decided to take that path. And that's when, I got to think, okay, what does an allergist do and what is an allergy? I'm sure somebody on this call has some form of allergy, whether it's cat allergy, dog allergy, tree pollen, or food or things like that. Well, if you think about the definition, I don't like this one, a damaging immune response by the body to a substance, especially pollen, fur, particular food or dust, to which it has become hypersensitive. Well, what the heck does that mean? So really what an allergy is, it's an abnormal response of the immune system to a harmless substance. And oftentimes it involves this immunoglobulin E that can provide an immediate hypersensitivity response to things it shouldn't respond to. There's no reason that ragweed that pollinates in the autumn should cause any problems for a human being unless you develop allergies to it. Same thing with a peanut. Why on earth would a peanut potentially kill somebody who has a peanut allergy? It's because they develop an immune response to it, and a cascade of events can occur if they eat it. All right, anybody familiar with this? This is like the immunologist mantra. So this is my biochemistry nerddom coming out. There's classifications of different types of hypersensitivity reactions. There's 4 different types. So type 1 is the classic immunoglobulin E or IgE antibody. If you have a peanut allergy and you eat a peanut, you have IgE, it recognizes the peanut, it unlocks all those allergy cells, you release a bunch of chemicals, and it causes all the symptoms that occur with an allergic reaction. There's type 2 reactions where you're exposed to something like a medication, and then your body forms an immune response and it starts attacking its own cells. Type 3, where you actually get complexes and you have the antigen, which is like a medication, and our own antibodies, they form these complexes. If you have too much of one and not enough of another, it's not a problem. If you get just the right amount, those complexes deposit throughout the body, inside the skin and joints and muscles and things like that. And these are conditions like serum sickness, or something called erythema multiforme, where you get these weird target rashes after taking an antibiotic or medications. And then I know somebody on the call has type 4 hypersensitivity because this is a delayed onset T cell mediated response. This is what poison ivy does. You brush up against the oil on a poison ivy plant, you're fine right away. You may not even have any issues for 12 hours or 24 hours. Then you get this delayed response where our T cells say, you don't belong here. And you get this very itchy, blistering rash. So these are very different parts of the immune system involved in these hypersensitivity responses. And I can use my understanding to help guide, a patient's history and figure out, oh, is your history consistent with allergy and where does it fall in here? Hopefully it's coming through that I am a huge nerd. I love all this stuff. The immune system is so complex and fascinating, and I get to use all of the biochemistry knowledge that I learned as an undergrad along the way. So as an allergist, we treat some of the most common conditions that you will find across the world. We know that environmental allergies to things like cat and dog dander, pollen, affect about 30 to 40% of all children and adults. This is across the world in different societies, different backgrounds. So these are very common conditions. Asthma is very common as well. We already talked about how that can cause reversible episodes of squeezing of those muscles inside the lungs, which can cause significant coughing, wheezing, respiratory distress. The picture up here is a picture of atopic dermatitis or eczema. This is a very common chronic skin condition affecting infants and toddlers, where they get these red, dry patches on their cheeks, inside their elbows, behind their legs. And it can be really severe in some cases as well, even debilitating. Of course, allergic rhinitis would be you inhale something that you're allergic to, and all those allergy antibodies start to release histamine, which makes you sneeze and itch. And then you get nasal congestion and runny nose. You can get itchy, watery eyes. If you have pollen allergies in the spring, that's when the trees pollinate. In the summertime, right now, is when we have grasses and weeds. Every autumn is when we have ragweed. And then indoor allergens would be things like cat and dog dander, dust mites, which we all have inside pillows and mattresses, and even rodents as well. And people can actually have cockroach allergy, especially in inner city areas. Food allergies, unfortunately, food allergies are increasing in prevalence over the last couple of decades, and it's very complicated as to why somebody develops a food allergy. But the 8 most common food allergens would include cow's milk, wheat, soy, egg, peanuts, tree nuts, fish or shellfish. Other foods certainly can cause allergic reactions, but those 8 foods account for more than 90% of all the food allergies that we see. And we'll talk about the Food Allergy Center towards the end here. And then medication allergies. Now, one of the cool things that we'll talk about a little bit further on is that a lot of people out there are told that they're allergic to penicillin. The vast majority of people who are told that aren't actually allergic to penicillin. So this is sort of a widespread campaign that we're conducting as allergists to try to help everybody understand the importance of delabeling these unnecessary allergy labels, because that can lead to, overuse of broad spectrum antibiotics and antibiotic resistance. Penicillin and amoxicillin are cheap. They're really good antibiotics for treating common infections, especially in children, such as ear infections, sinus infections, and strep throat. And then, of course, we treat patients who have venom hypersensitivity as well. So there's a lot of people out there. Everybody, when you get stung, venom is a pretty toxic thing. That's why these insects have venom. And we're talking about honeybees or yellow jackets and wasps and hornets. And all of us are going to get itchy and have some redness and warmth and swelling where they sting us. But some people, when they get stung, they actually have an intense allergic reaction across their body, or anaphylaxis, where they can actually have life-threatening reactions or even die from their sting. So we can identify that, diagnose that, and then often treat it using things like allergy shots. So what fellowship involves with allergy immunology? It's actually one of the unique fellowships. So after you go through all your training, so you have your medical school and you have your residency, then after that is when you specialize in your fellowship. We are the only specialty that has a 2-year fellowship. Many other specialties have a 3-year fellowship. So if you want to be a rheumatologist or even an emergency room physician for pediatrics or endocrinologists, things like that, that's 3 years. We also take those who trained in both pediatrics and internal medicine. So we've combined fellowships. And the reason why is because these allergic conditions, cross the spectrum of ages. We oftentimes will get patients when they're infants and they stay with us until they're adults. And then they have children who have allergies because it's a large inherited component to it as well. So we get combined training during fellowship, which is very unique. Oftentimes you'll just stick with pediatrics or internal medicine. And then the other unique aspect of our specialty, you can do anything you want. I'd say about half of people after their fellowship will just go into private practice where they'll just see patients, pretty much Monday through Friday in an office-based setting outside of a hospital. And they can do other things as well. Or you can go into academic medicine, which is what I do, where you generally will work at a teaching institution where you're working with medical students and residents and fellows in training, and then doing things like research and quality improvement and things like that. So private practice is a very different career path. Oftentimes it's, outpatient focused without really, having responsibilities to round on patients in the hospital or do consults or things like that. And with our specialty, there's wonderful opportunities to get involved with our professional organizations. So we have the American Academy of Allergy, Asthma, Immunology, the American College of Allergy, Asthma, Immunology, and there's practice management paths where people can get involved and network with colleagues and really develop some important algorithms and resources for people to use when they're in practice. And then there's academics. I'm sure a lot of the folks that you've had invited to speak with you all are in academic medicine. This is where we divide our time. Sometimes it's equally, oftentimes it's uneven. So we still take care of patients. If you are a leading researcher in some field, you're probably only seeing patients 1/2 day a week, if that, or you may just round on patients, 1 week out of every 2 months or something like that. Me right now, I was seeing patients 4 half days a week out of those 10 half days. Now I'm back up to actually 6 half days because I'm the director of our new food allergy center that we just opened a couple months ago, and I'll tell you about in a second. So I see patients pretty much every Tuesday, Wednesday, Thursday. And then I teach. I had a resident with me this morning. I'll have a fellow in training with me tomorrow, and they'll see patients with me, and they'll come back and give their presentations, and we'll do some education and go see them, in the room together and learn from there as well. I also participate in research, both with clinical trials and doing sort of retrospective reviews. And we have a large database that we can always go back and see, if our experience offers anything that the world may benefit from learning about. So I do some publications as well. And then I'm also the director of quality improvement. So there's a lot of different aspects of our specialty and just medicine in general that we can adopt quality improvement methodology to really just drive change for the betterment of patient care. And then I do have a lot of responsibilities with our various professional organizations that I'll tell you about in a second. So this is all to say that I keep pretty busy. It keeps me out of trouble, but I love every aspect of this. And you can choose anything you want to do. You don't get pigeonholed and say, yes, you're going to go into academics, so you have to do research in this area, or you have to do advocacy, or you can do whatever you want, which is really great. So what are we really good at? Well, I love what I do. I think we're really good detectives. We just ask a series of very specific questions. And every time I ask a question, the answer I get really changes the algorithm in my mind. It's like that movie with Russell Crowe from probably 15 years ago, A Beautiful Mind, where he's just seeing all the math equations kind of play out. That's what's happening when I ask these questions. And I've learned over the years, I can tease out in just a few short series of questions what the most likely diagnosis is. We have an inherent understanding of the immune system, something our colleagues don't understand, so they ask us questions about that. When I look at somebody with asthma, I'm already thinking about the type of inflammation, not just inflammation, but is it a Th2 inflammation mediated by certain cytokines involved in the allergic response? Or is it a non-allergic type of inflammation? Because all of that can impact the type of testing we may want to order, or the type of treatment that we may want to consider, because their response to treatment may vary based upon that as well. We're really good at crossing things off the list. We opened our food allergy center 2 months ago. Out of the first 120 new patient consults, 65% of them, we ruled out food allergy that day at the first visit. So there's a lot of concerns out there about chronic rashes, food touching the skin causing a rash, gastrointestinal complaints, who knows what. Just people are concerned, do I have a food allergy? We can clarify that right away oftentimes, and that's a wonderful part of our job as well. And then we have treatment options. We live in the age of personalized medicine. In immunology, we have really cool biologic treatments where we can actually target specific parts of the immune system, and we can just shut things down very high up in the pathway and prevent the release of those allergic mediators that really can improve quality of life and patient care and reduce symptoms. It's really a fascinating time to be involved in medicine in general, but especially in our specialty. And then we just educate. That's one of the most important things we do, is because when you have people that live with chronic medical conditions, they need to understand what they're dealing with. They need to understand avoidance measures. They need to understand their own symptoms. They need to understand the importance of treatment and how treatment differs based upon what treatment options they decide to do. And in order to learn those skills, it takes a lot of knowledge and it takes a lot of practice. And that's one thing that we're really good at, is helping people guide through that. I get, 30 minutes with them a couple of times a year during their visits, but they have to go home and live with their condition every single day. And here in Ohio and in many places across the United States, this past spring tree pollen season was miserable. We had tremendous levels of tree pollen for weeks on end. And that means that people were walking around there. They couldn't go outside because their eyes were swollen shut. They weren't sleeping at night because they were coughing nonstop, and they were always itchy and having mucus run down the back of their throat. And we were able to help them with that. In addition to being the age of personalized medicine, this is also the age of shared decision-making. And what that means is, as a physician and as the allergist, it's my job to say, here's what I think is the most likely diagnosis, here are the tests that we should consider, and here are the treatment options that we can consider. And then I need to sit back and listen and shut up. And that's when I try to elicit, what are your preferences? What are your values? What's the most important thing to you? Do you want to do everything you possibly can to avoid any potential side effect? Okay, that's going to be a different treatment approach. Or do you want to do anything you possibly can to make all of your symptoms go away completely? So there's different values that people have, and we need to meet them where they're at and really focus on the decision-making process. Come up with a plan, get together again, 2 months, 3 months, 4 months down the road. How are you doing? Did we achieve the outcomes that you were hoping for? And that's one thing that we really excel at in allergy and immunology. Another important area is discussing risk. So it's really important, especially with food allergy. I don't want people walking around thinking they're going to die if somebody down the street is eating a peanut butter and jelly sandwich. But if they don't have the right education about that, they're going to go online and find all kinds of misinformation. And anxiety is a very real component of living with food allergy. So we can talk to people about that, discuss that risk is highest with eating the food that you're allergic to. Casual exposure, such as being in the environment with it, is unlikely to cause any type of reaction at all. If symptoms do occur, here's how you can treat these symptoms. Here's your epinephrine autoinjector, when to use it, how to use it, things like that. So with my career path, it's somewhat unique. When I started out with patient care, I did, asthma was my first true love. When I finished all of my training, my first job was actually at Children's Hospital of Pittsburgh. My wife is a physician as well. She's actually working right now. She's a pediatric emergency room physician. So she had to do her 3 years of fellowship training after I finished mine. And she did hers at Children's Hospital of Pittsburgh, which is my first faculty position. And that's where I really pursued my love of asthma. Then we came back to Nationwide Children's Hospital. It was 10 years ago, actually. This is our 10-year anniversary this summer. When I first came here, I started a new complex asthma clinic where we designed it for children with frequent ER visits, hospitalizations, or difficult to control asthma. We could spend all of our efforts and attention on their needs. And as I discussed before, this can be very complex. So that was what I started 10 years ago. And then just in the last year, I transitioned to food allergy. My passion shifted from asthma to food allergy, and for similar reasons, because food allergy is extremely heterogeneous and it's not one size fits all. And there's a very individualized approach to care. So we just launched a brand new food allergy center that I have the honor of being the director of 2 months ago. So it's a new location, actually north of where our main campus is. So it's changed everything with my daily schedule and career path and everything like that, but I love it. I love teaching. I give a lot of talks and presentations. I get very kind invitations, such as with your group as well. But because of my career in academics, I've been able to travel the world. I got asked to speak in St. Petersburg, Russia 2 years ago, which was amazing. I got asked to speak at a conference in Mexico City, Montreal, and across the United States with our professional organizations. And that's really one of the true fun parts of the job. I love it. I love the opportunity to educate and to give presentations. And it's a craft, though. You kind of have to practice it. And I'll never forget, I had a fellow working with me a couple of years ago, and they said, well, I want to do what you do. And I just want to, get up there and give grand rounds or give a talk. And I looked at them, I said, all right, you want to do what I do? Give 200 talks on the same topic and get up there so you don't need any notes whatsoever. And you can discuss all the studies that you're going to present throughout your talk without any notes and without cheating. That's how you get to that point. So it takes a lot of practice, but I love it. I love all aspects of it. So every chance that I get to give a talk is a chance for me to really reach a different audience and practice making sure I'm getting my message across. For those of you falling asleep right now, I realize, look, maybe I'm not hitting a home run with this group, and that's okay. Whereas others, it may really resonate with. And then I do a lot of writing as well. I love to write and I love to edit. I have actually published 2 different textbooks. One was on transitioning adolescents with allergic conditions to independent management. And the other one was on social media for medical professionals. So my 2 passions, and we'll talk about social media here in a second, but I have lots of research papers as well. I'm part of a group called the Joint Task Force on Practice Parameters, where it's our job to actually review the literature and update the guidelines. So there's 12 of us that were appointed for a 5-year term, 2 5-year terms actually. And that's what we do. We write the guidelines and then we publish them, and we try to get people to understand what an evidence-based approach to these different conditions are. All right. I found Stoicism during the pandemic. I can't recommend it enough. And it's really given me mindfulness and gratitude, and has helped me stay centered. We've all struggled over the past year. I'm not immune to that. Pun intended, get it? But one of my favorite sayings is this one from Seneca. I'm sure you've all heard this. Luck is what happens when preparation meets opportunity. Well, I'm one lucky person, but I try my best to prepare. And what I've been able to get involved with over the years, I was formerly on the board of directors for the Asthma and Allergy Foundation of America. This is an advocacy organization that's wonderful, and they really help patients with asthma and food allergy and different allergies and things like that. And I started off just volunteering to be a medical advisor for them. And that led to me getting more and more involved. And then my involvement on the board of directors was really a wonderful learning opportunity for me to see how that can contribute on that level. For the American Academy of Allergy, Asthma and Immunology, I'm the producer and host of their podcast series. I'm also the social media editor for that organization. So we started a podcast a couple of years ago. I get to just basically think of the topics. I come up with the questions. I invite the guests, and then I get to have fun interviewing them. And it's a fun part of my job and my career. I'm on the board of directors for the American College of Allergy, Asthma, and Immunology. I joined them this year for a 3-year term. And prior to that, I was the chair of their annual meeting program committee. So I got to plan these big annual meetings for like 2,000 people. It was an in-person one in Houston in 2019. And last year, we had to switch to a virtual conference. But that was even fun for me to kind of go through that planning process as well. But as I mentioned with the Seneca quote, I wouldn't have been able to do any of this stuff without the work that I did starting at home at my institution. And when I joined Nationwide Children's Hospital 10 years ago, I became co-chair of an annual pediatric asthma conference. So we came up with agendas, invited speakers, handled all the logistics of putting things together. And I'm very proud to say every year we'd have over 200 attendees. One year we had them from 26 different states, including Australia, they flew in, and the Bahamas to come to our asthma conference. Are you kidding me? But because of my experience with that, it led me to really be able, when other opportunities presented themselves, that I could actually say yes to them and be able to contribute in a meaningful way. So I guess what I'm trying to say is, as you learn your way, say yes to as much as you can until you earn the right to say no. You never know what volunteer work or what endeavor you encounter or you embark upon may lead to other things. So it's really a great time just to kind of explore what you want to do in life and what your passions are. We opened our food allergy treatment center recently. You heard me mention that a couple of times. This was another learning process. I put the business plan together 3 years ago, presented it to the leadership at our hospital, and we happened to have space in an offsite location where it was shelled out. I actually got to draw the blueprints for the rooms that I'm treating patients in all day today and tomorrow. It's a really cool thing. And I was able to do that because I was able to communicate the vision that I have and demonstrate why that's of value to our community and our patients. All right. So as we wrap up here, social media, as I mentioned before during my introduction from Michael, I'm very involved in social media. And as you all know, we've gone through a very difficult pandemic. And it's interesting that in February of last year, before I think it was even officially a global pandemic, the Secretary of the World Health Organization called it an infodemic. I don't know if you're aware of this. And the reason why is because there was so much misinformation, flying fast and furious everywhere that nobody knew what to make of anything. We've always had misinformation out there. Before COVID-19, there's a very strong anti-vaccine contingent. I don't know if you're aware of this, 2% of adults in the United States think that the earth is flat, like they honestly believe the earth is flat. 9% of people think that the chemtrails that planes leave in the sky are a form of government mind control. People used to say that 4G technology was, killing us all, causing cancer. Now it's 5G technology spreading COVID. So this has always been out there. But during the pandemic, everything is sort of focused on COVID. And then, of course, social media is a big part of that. I don't know if you've seen the Netflix documentary, The Social Dilemma. If you haven't seen it, I highly recommend it. And what they do is they basically interview some of the people who started these different social media platforms, and they admit that the algorithms they developed at first to get people to interact with one another, likes and reposts and things like that, that algorithm has taken on a life of its own, and it's impacting all of us. Everybody on this call right now, if we opened up, say, Google, and we put in the same exact search term, we are each going to get something very different in our search bar because the algorithm knows what we've sort of looked for in the past. They know where we hover for just a second longer than other sites. They know where we click things. So we all need to be very savvy these days because there's misinformation everywhere. And I encourage all of you, see what you find. This is one of the things that I started doing years ago. I kept hearing the same misconceptions from people over and over. So I put the same search terms in Google and then in PubMed and looked at the published literature on this. And if you look at what comes back with Google, oh my gosh, it'll make your head spin. And there are times when I go deep down the rabbit hole and I can't even make heads or tails of what's misinformation and what's the right information. So if you're not savvy in this, you don't have that medical background, a lot of times people don't stand a chance. This is a shot of my Twitter profile. I joined, the hospital backed me. They loved that I wanted to do this in 2013. Actually, that's a picture of my son from 8 years ago. The hospital set up a photo shoot for us, try to make me look very friendly, like a smiling pediatrician. I just have my professional picture, and you can see my profile. You're all familiar with Twitter, but I'm telling the world, if you happen to find me, I'm a pediatric allergist, immunologist. I'm the director of our center, dispelling myths one tweet at a time, often zigging when others zag. And I love it. I use social media to put out evidence-based information. There's been a lot of information on COVID vaccines today. Today, I posted something because they're trying to pass some anti-vaccine legislation in my state. Every Friday at 4 o'clock Eastern time, I'll put out a really bad joke of the week. This started 8 years ago as a way for me to learn more bad jokes for my kids and for my patients. And it took on a life of its own. So people now actually look forward to that. They send me jokes. It became like a thing that I'm known for. I have yet to repeat any joke ever in 8 years. And the well is running very dry. I joined Instagram about 3 years ago and really didn't know what I was doing. Still don't have a great grasp on it. And it's just hard to keep up with everything. But the food allergy community is very robust online, and they found me recently. And you see, I recently passed 10,000 followers on Instagram as well. So I see the value in social media. I believe that we all need to be out there as medical professionals giving really good quality advice. Not never individual advice, but giving evidence-based information. And people, want us out there. They're seeking information. And what I try my best to do is bridge the gap of what are the peer-reviewed evidence-based publications show, and how does that differ from what people are going to find in common search engines. And there's a lot that goes into it. And it's taken me a long time to get to this point. And now it's fun because I get to help educate others about some strategies for when they first get involved. It doesn't stop there. I love writing blog posts. I told you before I love to write. So our hospital, Nationwide Children's, has a very robust blog site with thousands of entries written by hundreds of our physicians and allied health professionals. I have submissions to Kevin MD, Huffington Post, MD Magazine. These are just great ways to kind of, briefly address something in a more informal way. And then I don't know how many of you are familiar with ZDogg, if you guys know. So Zubin Damania, he became, ZDogg several years ago with these fun like parody rap videos and stuff like that. And he's taken on a life of his own. He has millions of followers, and now he has a very popular podcast, YouTube channel where he really dispels misinformation and takes on anti-vaccine proponents and all kinds of stuff like that in healthcare reform. Well, because of what I did on social media, I had the chance to go on ZDogg's show a couple of years ago. This was when he was actually based in Las Vegas. I happened to be there for a conference I was teaching at, and he, invited me on, and we talked about, allergy myths for 45 minutes. And this has, garnered over, I think 500,000 views. This was just us hanging out talking about allergies, me using his platform to reach his audience. And then similar to that, this is Dr. Mike Varshavsky, who I believe was named the sexiest doctor alive by People Magazine in like 2016 or something like that. He has 6 million followers. And Dr. Mike invited me on. This was right before the pandemic. And I actually happened to be in New York for another conference. And I met with him at his home, actually, which is a studio. And we had 2 separate videos that we filmed on allergy myths and misconceptions. And these have been viewed almost 1.5 million times in combined viewership. So without social media, without me having the practice I've had with giving presentations and talking points and giving media interviews, stuff like this never happens. I don't get a dime from this. I don't make any money, but this is a way for me to use their platforms to disseminate really good information that people can learn from. And the comments I get from folks, it's really remarkable. It's quite touching. And people say, I've lived with this my whole life, and after watching this now, I understand it. Or based upon what you said, I'm starting to question my diagnosis. I'm going to go talk to another doctor or something like that. And then at our institution, we have an elective rotation for medical students and residents that we started 6 years ago to help teach them some strategies for using social media as a medical professional. If anybody's interested, here's the link. Take a screenshot or write it down. You can go on. Our podcast modules are actually, our curriculum is a series of podcasts. You can all listen to it. This is the textbook that we wrote. These are my partners in crime at doing this. And we actually have an annual conference as well. We just had a virtual conference, and we were able to invite speakers from across the country, actually in Canada as well. And they joined us virtually and talked about their social media use as well. So this is me sort of putting an academic slant to going on social media. It's one thing for me just to be an allergist going on Twitter and posting funny memes or, giving information about pollen or stuff like that. But just the academic nature of what I do, I took it that next step. And I applied it to the work I do with the American Academy of Allergy, and Immunology here at my institution with educating others and writing our textbook and things like that. All right. Do we want to go through a couple of cases, or do we want to stop for questions at this point? It's totally up to you guys. I'm sorry, men and women, and people on the call.
We'll do some couple of cases.
Okay. I just threw a couple in here to kind of highlight what we work on. All right. These are all actual patients that I've seen. This first one really highlights a lot of what's wrong with food allergy testing. This was a 6-year-old girl came in to see their pediatrician because she has sneezing when she's around dogs. That's a common story. Also in the spring, she gets itchy, watery eyes. She gets a cough and then frequent upper respiratory infections. Their well-intentioned pediatrician ordered something called a childhood allergy profile. A childhood allergy profile is a random assortment of different blood IgE tests for a whole bunch of different allergens. The lab basically puts these together, and it's a random assortment. The results that came back were these. So you get numbers, the scale goes from 0.1 to 100. Anything really above 0.35, which is the old cutoff, you get the big red exclamation point and you say, oh my goodness. So we have a 6-year-old girl who sneezes around dogs and gets itchy, watery eyes in the springtime. The only inhalant allergens they actually tested for were cat, cockroach, dog, and dust mite. They didn't actually even include tree pollen, which is what she was having symptoms to in the spring. But you know what they got? They got banana and codfish, and they got egg white and milk. And the family was called and they said, stop feeding her these things immediately because she could die if she eats them. That's not the case at all. This shows that this is one of the major problems that we have in the world of food allergy. Our food allergy tests, we have blood testing. We also have skin prick testing. Take a drop of liquid allergen, place it on the skin, gently scratch through, introduce it to those allergy cells. If the IgE is present, it will unlock those allergy cells releasing histamine. You get a hive within 15 minutes. The size of the red hive that you get indicates the likelihood that allergy is present. Same thing with blood testing. The size of the blood test indicates the likelihood that allergy is present. These tests by themselves don't diagnose allergy. There's tons of false positives. This is a prime example of why people are walking around thinking they have 20 different food allergies because they were tested for foods that they've either never had a reaction to or that they've never eaten. And that's a huge problem. And this is one of the most important slides that I present when I educate about food allergies. So there's sensitization and then there's allergy. Sensitization is merely the detection of IgE through a skin test or blood test. About 40% of children are sensitized to milk, egg, peanut, or shrimp, but only about 5% are actually allergic. So if we rely upon testing alone, we're going to overdiagnose the vast majority of people. Whereas the history, go back to what I said before, we play detective. As detectives, we use very specific questions to determine, does your history suggest that you have food allergy? Are you having rapid onset reproducible symptoms every time you eat a food? What are those symptoms? Are they red itchy hives, swelling, vomiting, wheezing, anaphylaxis? Is it, I eat something and then 4 days later my left toe is itchy? I believe you and I hear you. I'm just not concerned that that's due to a food allergy. So this is one thing that we do all day, every day. I mentioned before how we undiagnose food allergy a lot of the times on the first visit. Oftentimes I'm just looking at the same piece of paper that somebody else did, but I'm interpreting it very differently. This is a schematic of the skin testing that we do routinely in the office. Has a very low positive predictive value. These are not screening tests. You'll learn all about the very basic metrics that a screening test needs to meet, and food allergy tests do not meet any of those metrics whatsoever. So we shouldn't just be casting a wide net to see what comes back. And then with the blood testing, we get various results as well. So the big red exclamation part, that's a really nice touch that just scares the hell out of everybody when they see that. And both these tests are very similar. So I like to say that these are not pregnancy tests. They're not positive. They're not negative. It's not a yes or a no. They're not diagnostic. So we just have to use the test results to determine the likelihood that allergy is present. Okay. On a similar vein, this was a 2-year-old who had frequent episodes of hives. Hives are big red itchy bumps that can occur, randomly in most cases. Parents say, listen, he gets hives every time he eats dairy, egg, wheat, soy, peanut, tomato, strawberry. And they said, we've taken all these foods out of his diet, but he still gets hives. What could be going on? They saw another allergist and they did skin testing, and they were told that he has more than 20 food and environmental allergies. And worse yet, they said, listen, if his hives ever spread past his chest, inject him with epinephrine. Epinephrine is the only treatment for anaphylaxis. We all have epinephrine in our bodies, also called adrenaline. It works really fast. It treats all the symptoms and it's very safe to use. So we want to use it when anaphylaxis occurs. But my goodness, they gave it 7 times in 2 months for just hives because they were told very specifically anything more than the chest. And they came to see me, not because of the food allergies. They were worried he had something called mastocytosis, which is an abnormal proliferation of these mast cells throughout our body that can cause major problems for people. And then in the office, I did one thing in the skin that clarified the diagnosis. I took a tongue blade, which is made out of wood. I snapped it in half and I gently drew on the skin. This isn't what I saw. This is dermatographism. So there are people out there that just get hives for no good reason. It's the same allergy cells involved in an allergic reaction. We treat it the same. It looks the same. It's just not caused by anything you're allergic to. This family thought he had 20 food allergies. They stopped feeding him. He's kept getting hives. He just had dermatographism, which is a physical form. You scratch the skin and you make a hive come out. There's really cool pictures online of people writing poetry, playing tic-tac-toe on their skin and things like that. It's very common. But because of my understanding of this, I was able to clarify that we did some blood testing and we lucked out. We didn't get a lot of false positives. And then we did oral food challenges. So an oral food challenge is the gold standard. Come hang out with me for half a day. If your story is indeterminate, if your testing is indeterminate, or if we think you're outgrowing your food allergy, let's just feed it to you in gradually increasing amounts in a very safe way. If you eat a serving or two, nothing happens, you're not allergic, because food allergy is going to be reproducible every time. So we were able to clarify that for this family. It changed their entire lives. They thought their son had weeks to live. They thought he was going to die at any moment. It was really tragic. And then, well, lastly, we'll talk about penicillin allergy. So the most common presentation would be you take a child of any age and they're taking amoxicillin for an ear infection. And on day 5, 6, 7, 8, 9, 10, they get a weird red rash. A lot of times people are told, oh, they're allergic to it. You need to stop giving it to it. They should never get it again. That's the most common story. Well, we now know through our understanding of drug allergy, 10% of people, which means somebody on this call tonight absolutely has been told you have a penicillin allergy, but more than 90% of those people actually aren't allergic to penicillin. That's a real big problem. So we need to figure that out. So non-specific rashes, or oftentimes just known side effects, people are told, oh, you must be allergic because you get upset stomach or yeast infections, things like that. So we use the clinical history. It may sound boring, but it's the best part of our job. We take our understanding of the immune system, we ask detailed questions. The response to those questions guides us down. What was the timing of onset? What were the symptoms? How long did it last for? Best, have you gotten it again? If you've gotten it again, even if it's a slightly different form and nothing happened, you're not allergic to it. And then oftentimes we can just take it off the chart right away. And we have widespread campaigns. I'll show you some screenshots at our hospital to really address this everywhere from the emergency room to the inpatient unit to primary care to our office as an allergy. Have you received it again without problems? You're not allergic. You can't really recall what happened. You're probably not allergic. Delayed onset rashes, rarely due to allergy. If it happened more than a decade ago, even if it was an allergy, it's often gone. Allergies are not inherited. The tendency to develop allergies is inherited, but specific allergies are not passed down. So a lot of times children are told they're allergic to penicillin because of a parent who feels that they're allergic to penicillin, which, as I just mentioned, they're probably not allergic either. Or if they have known side effects, or if they have yeast infections, or just false assumption about cross-reactivity. We have skin testing we can do. We oftentimes don't even have to do that because the vast majority of stories aren't consistent with that IgE immediate anaphylaxis. So oftentimes we just feed it. Just give you a little bit of amoxicillin, nothing happens. We give you the rest of it. We watch you. We rule out the chance for any type of immediate reaction. 96% of people with that delayed onset rash, they do this and nothing happens. About 4% may get a delayed onset rash, but it doesn't progress to anaphylaxis. So we have tools that we can easily do to assess people, starting with the history. And this is a screenshot of our institution. We have one of the, I think maybe the largest pediatric academic institution in the country at this point by number of beds. So it's a big place and we're continually expanding our campus. And one thing I like to say is, at our institution, there's 13,000 people that work here that have the ability of placing an antibiotic allergy on their chart. And there's only about 9 that feel comfortable removing it. That's the 9 of us in the allergy division. But anybody can take it off. If you feel empowered enough to put it on there, that can stay for the rest of their lives, even if it's incorrect. We need to educate all the workers that I work with side by side and say, listen, this is allergy, this is not allergy. Let's take it off the chart if we can. These are signs that people see walking around our hospital. You're waiting for an elevator, you're going to the cafeteria. We're bringing it to the forefront. We're bringing it to the attention of parents. Ask about this. We're keeping it constantly on people's minds and saying, listen, this is probably not an allergy. Let's address this. We have algorithms that we publish. These are publications that I helped design, and it's on our website. We put mailings out to the community as well. And then lastly, we came up with Penicillin Pete. So we have a complex algorithm on our inpatient side through our Epic electronic medical record. So there's a series of questions people ask when people are admitted with a penicillin allergy. If the answers to those questions indicate they're not likely allergic, Penicillin Pete shows up for the rounding team and they say, hey, guess what? Your patient probably isn't allergic. Would you like to feed it to them while they're here? And if they don't have time to do it or they're too sick to do it, then they can refer to us and we get them in and we see them, we delabel them. So hopefully this gives you a sense that this really takes a lot of work. It's a widespread problem, but this is quality improvement. This is one of the things I love to do, and we're making headway in trying to reduce that. So as I wrap up here, and I thank you all for your attention, and I'm more than happy to answer questions and hang out. Our career in allergy and immunology can be anything you want. You can be the world's leading researcher on mast cells and stay in your lab and, kill mice in the name of science all day, every day, and publish your findings. And you're an allergist and immunologist. You can go into private practice and treat patients all day, every day, and make their lives better. Or you can choose a career in academics like I do and do a hodgepodge of whatever you want. Regardless if it's allergy, immunology, regardless of if you go into medicine or not, you can do anything you want, but have goals, because if you don't know what your goals are, how are you ever going to know what path to take? So just be thoughtful about it. Allow yourselves the opportunity to change your minds. Remember, I was going to be a civil engineer when I was in high school. I am not a civil engineer today. I was going to be a cardiologist when I started my residency. I am not a cardiologist today. All right. So hopefully this offers some insight and some thoughts. And I'm going to stop sharing now. And thanks again for hanging out tonight.
Yeah, definitely. So thank you, Dr. Stukus. We have a few questions, and if you don't mind, we'll go through a quick Q&A up till around 8 o'clock when we usually end.
Sure.
So the first question we have here is, how do you use your platform, skill sets, background to give back to the community? Also, what kind of volunteer work do you do outside of all of these different jobs you hold?
Yeah, great question. So a lot of what I do is advocacy. So here in Ohio, I was able to be a proponent for legislation that allows schools to stock epinephrine for anybody, any student or staff member that has anaphylaxis. And since then, since they passed this in 2016, now I actually write the prescriptions for schools across Ohio. They send them to me every year, and I fill them for them. People I've never met before. I want to give back, and I was able to leapfrog that. I was able to actually introduce legislation. We did the same thing with albuterol. So there's a lot of kids with asthma that don't have their inhaler and they have to call the squad. Well, we can fix that. Just let schools give albuterol. It's pretty harmless to give and it can make a huge impact. So we did the same thing and we did that with albuterol as well. So that's just one example of how I sort of give back in my community here and really the state of Ohio. As far as volunteer work, I volunteer my time a lot, like as a medical and science advisor for different advocacy organizations and things like that. So I'll often just give advice for educational programs, or I'll give talks or things along those lines. So that's really where I volunteer most of my time now. But going through the process, I was a child life volunteer as an undergrad, which I love. So I would just hang out in the Children's Hospital in Pittsburgh. And I think it was like 3 hours a week. And I would just go hang out with kids that were admitted for a variety of reasons and play with them. And I thought that was just awesome. So if anybody's thinking about that, if they start getting back to volunteer opportunities, that's a wonderful way to do it.
All right, sounds good. Thank you. Another question we had is, what's something you wish you knew as an undergrad about pursuing medical school?
Oh, that's a great question. You know what? You have to check the boxes. So you have to have a certain GPA to be competitive, and you have to take the science courses that they require in the MCATs, but you don't have to major in science. That's not a prerequisite. In fact, a lot of medical schools like to take people that have different backgrounds. I went to medical school with people that were 50 when they started. One of them was an airline pilot. This was his second career. So you don't have to fit in that little box. Do what you're passionate about. That undergraduate time is a wonderful time to learn about yourself, learn about how you learn, how you interact with others. So keep that in mind, but you still have to play the game and check the boxes and make sure that you're competitive as well.
Thank you. Going off of that question, for high school students though, what types of opportunities should high school students start looking into if they're interested specifically in allergy/immunology?
Well, you can volunteer. There's shadowing opportunities that you can often do with local medical schools or practices, or just call, if your family knows somebody, if your pediatrician knows somebody, just cold call them and see if they can come hang out with you. I've had that happen all the time. And I love it. Come hang out with me for half a day. I'll expose you. And you get to see what I do on a regular basis. So that's an easy way to do it. Or you can volunteer in hospitals or different clinics and things like that.
Definitely. Also about allergic reactions, can they be reversed?
Well, so it depends on what you're talking about. In the acute setting, we can treat allergic reactions, but long-term, we can desensitize medication allergies, but it's only temporary. You have to continually be exposed to that. Otherwise, if you stop it, you're no longer considered desensitized. We have immunotherapy that we can give through allergy shots or drops under the tongue for inhalant allergens, which can often desensitize or cure somebody after long-term use for years and years. And we're just now exploring that with food as well. So we can take somebody with food allergy and give them very small amounts to eat every day. It's not likely going to be a cure for them. It may not even allow them to eat as much as they want, but it may be able to protect them from having a severe life-threatening reaction if they accidentally eat it.
Mhm. Yeah. You also mentioned publications during your presentation. So out of those publications you've done, or just in general research, which one are you most proud of being part of?
My first textbook. That was a daunting process. That was a cool experience, but me being able to put that together and invite other authors to contribute and edit the whole thing, that was quite an accomplishment. And by the way, for those of you thinking that you're going to get rich being an author of a textbook, my royalty check is about $40 a year. So pursue other avenues.
So about the actual practice of medicine, when you have to go into pediatrics, you have not only the child but also the parent. How does it go when you're dealing with parents indirectly while you're working mainly with children in pediatrics?
That's the fun part, because we're going to work with infants who can't communicate at all up through adolescents who don't want to communicate. So that's part of the challenge and part of the fun. So we're not only treating the child who's our patient, but we're actually educating the parent with various levels of health literacy and understanding and things like that. I think that's one of the most fun parts of the job. But it takes a lot of practice. It takes a lot of patience. That's where the psychology comes into play as well. And there's a lot of worried parents out there, and you can always tell with first-time parents. And you just have to spend time and listen and validate their concerns, and then offer an explanation of why you think that their child is actually doing everything okay.
Mhm. Yeah. So about food allergies, they're caused by self/non-self antigens. How can some of those foods become common allergies while others are not? And kind of tagging along with this, why aren't humans allergic to all foods, since all foods are technically non-self?
Oh boy, that's a deep question. Yeah, so we don't know why. There's a lot we don't understand of, why does somebody develop a food allergy versus somebody doesn't. There's probably complex genetic environmental interactions that occur early in life. We're just now exploring the microbiome, which is fascinating. And there's probably something there about the different types of bacteria that are on us and in us and how that influences our development of allergies. As far as why some are more common than others, it's probably just because some are more frequently eaten than others. Fruits and vegetables are rare causes of true allergy because the proteins they have are often degraded very easily just by cooking or heating or processing. So that's one reason why, but we don't know. Those are great questions. We don't know.
And that's why we have research, right?
That's right.
Yep. So you mentioned a lot about the effort and time you put into not only pediatrics, but things like founding the new treatment center that you have. With that in mind, how do you balance your work-life balance when you have, your kids, your spouse? How does that go for you?
It became very easy for me several years ago when I prioritized my family first. So everything is secondary. They always come first for me. So it's an easy decision for me. Our kids are older, they're older now, so they're 8 and 11. So, my wife is working right now. I did bedtime with them. I read to my daughter for a little bit, and then, I kissed them goodnight, and I'll go up now and I'll tuck my son in as well. So you navigate it, but that puts everything in perspective. So family first. I don't work on weekends or at night. At least I rarely do. Believe it or not, because I see too many of my colleagues that are going through burnout or have gone through burnout, and they're sending emails nonstop, and they are victims of their phone. Turn off the notifications, turn off your work email, step away. You have to have boundaries. And I've been very good at putting those boundaries up. It doesn't mean that I don't work my tail off when I'm working. When I'm working, I'm working. But I've also been told and sort of learned that I'm unique in the way that I process information. So I used to think I was a procrastinator, and I am, but I've never missed a deadline. And if I have a talk due Friday at noon, I may not even start it until Thursday, but I'm always thinking about it, working on it. So in my mind, I put it all together, and I do this when I write as well. Can't explain it very well, but I can write it out in my mind, and I just need to sit down for 2 hours and type it out. I edit it once. And also, most importantly, for all of you, I strongly recommend you adopt this approach. Perfection is the enemy of the good. You can edit something you're working on until the end of time, and it will never be perfect. And when it comes to a publication, you have to submit it for peer review. You can think it's the greatest thing ever. Now you have 3 reviewers, they're going to rip it to shreds anyways. So it doesn't matter what you write. Get it to the point where you're comfortable with it and you're satisfied with it, and then you're done. And then take the next step, because otherwise you get caught in that endless loop.
All right. So you mentioned also you had multiple organizations you're involved with, being a board member and such. That took, I'm sure, many, many years. So when you did that, you were obviously building relationships with doctors. How did that go? How did you go about building those relationships? Because obviously we have a lot of undergrads, maybe a few graduate students here who are at that stage where they're networking and looking into experience for that.
Easy things. Be polite. Answer emails in a timely fashion. If you commit to something, show up. Under promise and over deliver. Keep that with you for the rest of your life. That it doesn't take much, but believe it or not, very few people do those things. That's all I've done. I smile, I shake hands, I'm polite, I answer emails. I'm polite to everybody, especially the administrative assistants who help schedule things and things like that. So I don't do it, it's just who I am. These are all people. But there's a lot of people out there that don't do that and take things for granted. So at your step of the game, or your stage in your careers in life, I should say, be as valuable as you can. If you're going to ask somebody for their time, make it as easy as possible on them as you can. Like this process tonight, it was great. I got a wonderful invitation, wonderful email, and a very prompt email from Sue Haas. He made everything easy for me. Followed up, hey, everything ready to go. Here's what I was thinking. That's great, Dave. Let's go with it. And then you set it up, and here we are, which is very different than, oh, would you mind presenting to us? And then you disappear for 2 weeks, and then you show up, hey, tomorrow night, does that work for you? No, that doesn't work for me. So just being thoughtful about how you interact with others when you ask them for their time.
All right. And just to end the session off, because we're coming to the near end of our time, you mentioned psychology being one of the foundations for your later career pursuits. How much has your study in psychology helped with your career today?
I use it every second of every day, especially on social media. I didn't even talk about cognitive bias. Oh my gosh, that's a whole other hour together. So my understanding of cognitive biases and the way people process information and make decisions has impacted everything I do, from the education I provide to that individual patient in the office to how I craft a tweet. It may not seem like it sometimes, but there's a lot of thoughtfulness to the words that I choose to use on my tweets. And some of them take off as compared to others. And the ones that take off, generally, I'm using all that I know about the nefarious individuals out there and how they gain traction, because we can use that to our advantage as well. So yeah, it's fascinating. And I encourage you to read about these things and think about how, mostly to understand your own decision-making, because we're all subject to this. We all have our biases.
Definitely. So I think that wraps it up for our Q&A session. We're nearing the end of our time, but thank you so much, Dr. Stukus, for taking time out of your busy schedule to join us today. For our audience, to receive a certificate for this session, you must pass the quiz on our website, which will now be uploaded. And be sure to join us next week, where we're going to have our next virtual shadowing session with Dr. Atay on Wednesday, June 16th at 7 p.m. Central. Again, thank you, Dr. Stukus, for your time, and have a great night, everyone.
Thank you, everybody. Appreciate it.
Thank you.
Thank you.